to start with Taylan Pince, who is the CTO at Avocare. He's a product builder, robot nerd, and he's passionate about quality software in healthcare. Tonight, Taylan will be speaking about AI in healthcare, empowering patients and healthcare workers with technology. Welcome, Taylan.
Just the right arrow. Just this one. Hello. Ooh. All right, so let's see. Okay. So my name is Taylan Pince. I'm going to be talking a little bit about our journey at Avocare, but primarily about what I learned personally being a CTO in the healthcare space, a first-time CTO in the healthcare space, and what I learned about how to use advanced technology to work with patients and healthcare workers and clinics specifically in Canada. So a little bit about Avocare. We are essentially a clinic communication portal. We allow patients to connect with their clinicians, physicians, clinic front desk staff, and any other health workers at clinics, online or through any channel that they choose to use. Before we launched Avocare, we looked at what landscape was like, basically, what people were using. And if you dealt with any of the healthcare systems in Ontario, what you see is essentially a voicemail tagging, as I call it. The clinic calls the physician, or you call your physician or your clinic. You can't reach them because their phone lines are completely overloaded. You leave a voicemail. The clinic front desk staff has to listen to those voicemails, which is a very lengthy and time-consuming job. And then they have to take action and then call you back. They might not be able to reach you. They leave you a voicemail, and so on and so forth. This cycle just keeps going. So what we ended up building, looking at the system, was essentially a communications hub that took many different channels. So patients can go on their iPhone apps, Android apps, through SMS, through our online portal. They can just send messages, and the messages will be routed to the correct people at the clinic. We have patients, messaging their clinics at 3 a.m., in the morning, whenever they want, and then they get back timely responses whenever they need to. So it works for everyone. It's a fairly simple use of technology, but it had huge impact on over 12,000 patients in Ontario up to today. So we've been doing this for the last 2 years, but shortly after we launched, there was the idea that, okay, we are this communications hub and we have a lot of data. How can we go further? We're seeing a lot of gains in time, but how can we, leverage technology further to go beyond? And the obvious solution was AI. And everyone was like, oh, AI is going to take our jobs, robots are going to take over the world, this is going to, or, to be more realistic, there was this big fear that, oh no, this is going to get rid of front desk staff jobs and it's going to replace people. And, let's face it, this is the state of AI today. This is the extent of what robots can do. This is AI, as I like to call it, is more like artificial inference. It's not artificial intelligence. There isn't a lot of intelligence in there. So we have a lot of data. We have a lot of processing power. We have some clever engineering tricks that are fairly simple. It's simple math. There isn't, anything black boxy, anything that we can't solve in there, anything we can't understand. What we do is we take all of that data and then we see what humans have been doing, and then we just infer results. So, we said, okay, how can we leverage this and how can we utilize this in the healthcare space? So we look at our success results in many different ways. We look at the patient happiness rates. We look at the clinician happiness rates. But one big thing that we look at is the phone call volume that's incoming to the clinic. So you can see this is just one clinic that we've been working with. As we launched and as we increased our incoming requests, what we started to see is the phone call volume drop in the clinic front desk specifically. What this meant is that the front desk staff had more time on their hands to deal with a lot of the internal bureaucratic, paperwork that they had to deal with. They could handle the incoming patients who are actually at the clinic in person better. They could have better communication, more time for the patients that who needed help. And then by leveraging AI and by routing these requests to the right people at the clinic automatically, and also instead of just giving them a conversation, just the chat box, we could also give them a summary of the incoming request. So our chatbot or our online systems could actually summarize what the patient wanted, and they could actually infer what they wanted to do and who they wanted to talk to. We were able to really save time on menial tasks that they didn't want to do, and they could focus on things that actually mattered, like talking to people and talking to patients and helping them. So just a few things that we've learned throughout this process is we started by, first of all, understanding the staff and the patients. And we didn't assume, we didn't think, okay, technology is awesome, let's just implement this. We actually went there and sat down at front desk and just watched them work for over a week. You know, we started to see certain patterns, we started to see certain pain points. I think this is really critical, and it's a kind of a step that a lot of technologists especially just jump over. You know, they think of this as just something really annoying, but it's something that we all need to do, is we need to learn from existing conventions. Another thing that we need to do is respect what they're actually doing today. So we can't just replace their technology with something all shiny and amazing, assuming that it's gonna work. Let alone the technology requirements, just the conventional, the UIs, the user interfaces that they're working with, the kinds of interactions that they're having. You can't just change those conventions overnight. You have to do it slowly. You have to understand what they need to, what they need to adapt to. Yes, I would love to replace fax in every clinic, but the reality is they use fax, and you can't just replace it, and you need to accept its existence. And then you empower them with tech, and then you give them tech that's actually, not in their face, that's mostly invisible, working behind the scenes, and it's just helping them do their jobs better. And we've seen that work really well. So I think AI plus humans can mean, happier healthcare workers, happier patients. It can have amazing results, as we've seen in our business. And thank you. So I think I have 2 minutes for Q&A. No questions? One over there.
What was the hardest challenge you had during the product development?
I think it was basically information gathering. It's not a challenging technology to implement. It's not a technology problem. It's more about spending time with patients, spending time with doctors, spending time with front desk staff, and then understanding the internal flow at the clinic, because it's not just these people. There are many different flows within a healthcare clinic, and we've only been focusing on family health teams. So, when you go to a hospital, it's a different thing. So just spending time at the clinic, understanding how they work and why they do certain things, you will see the pain points, but it takes time. It takes a lot of interactions, a lot of conversations. At least for me, that was the biggest challenge.
Hi, I'm Mayank. I work at Mount Sinai Hospital. We just had our 5-year strategy session. We have a lot of clinics within the hospital, but we were wondering, are you within any hospitals at this point in time?
No, not yet.
Okay.
Only independent family health teams so far.
Okay.
We spoke to a few hospitals,
Yeah.
But not yet.
Okay.
Yeah.
Are there any plans to be in the hospitals? Because
We would love to.
Yeah.
We would love to.
Okay.
Get in touch.
Okay.
Hello. How you doing? What are your thoughts around distribution for this type of technology? Are you going like top down, selling to health systems, or more bottom up, going physician to physician? And like, how does that translate maybe to different provinces or different countries?
Yeah, I mean, we haven't thought about different countries, but within Canada, even province to province, it changes. As you might know, in BC, for instance, this is the online communication is actually covered by their healthcare system, whereas here it's not. So it's a very different approach. We've been focused on Ontario mostly so far, and we've been going more, grassroots and just talking to physicians and clinicians directly. Which is not an easy route because it's hard to reach those people, as we've seen. But we would love to talk to hospitals, but it's a very long cycle and it takes a lot of time. But yeah, we're basically trying everything we can to expand our reach because we know now that the technology works well.
Hi,
Last question.
I'm Apurv. I wanted to ask you, so you've been talking to all of these people. What are the biggest pain points that you have been seeing, from patients and physicians?
From patients, it's mostly not being able to reach their doctor, not being able to reach their clinic without actually being there in person. And if you just need a prescription refill, you really don't need to go to your clinic. You shouldn't have to drive however many minutes or hours to go to your clinic, or you shouldn't have to wait. It's just something that could be done online. Or if you have a simple health question, you should just be able to reach them, with a text message or with an online message. So that's the biggest pain point from patients. From the clinician's perspective, I think at least at the front desk, where we're the most, active, it's just they're just overloaded with tasks because they need to deal with a lot of the internal communication at the clinic as well as the patient communication. So giving them tools that actually work and that are not hard to use have been, a complete godsend for them. They just love us, and they just keep thanking us. Every month we just receive this message from the front desk staff saying, thank you for, making my job, making my life easier. So I think those are the two biggest things, but there's so much more that could be done beyond that, and we keep seeing opportunities there. Yeah.
Thank you so much, Taylan.